the DOH is confirming that a 38-year-old female Chinese patient under investigation, or PUI, is positive for the novel coronavirus 2019 NCOV after her lab results arrived today from the Victorian Infectious Disease Reference Laboratory in Melbourne, Australia. The DOH, however, continues to guarantee the public that all necessary precautionary measures are being taken to halt the spread of the virus. The confirmed case arrived in the Philippines from Wuhan, China, via Hong Kong last January 21, 2020. The patient sought consult and was admitted in one of the country's government hospitals last January 25 after experiencing mild cough. She is currently asymptomatic. So let me repeat. She is currently asymptomatic, which means she has no fever and no other signs and symptoms suggesting illness at this point. I assure that the public that the DOH is on top of this evolving situation. We were able to detect the first confirmed case because of our strong surveillance system, close coordination with the World Health Organization and other national agencies, and the utilization of DOH's decision tool or the evaluation assessment tool. We are working closely with the hospital where the patient is admitted and have activated the incident command system of the said hospital for appropriate management, specifically on infection control, case management, and containment. We are also implementing measures to protect the health staff providing care to these patients. DOH is also in close coordination with the Interagency Task Force on Emerging Infectious Diseases, or EID, which includes representatives of the Departments of Foreign Affairs, DFA, the DILG, Interior and Local Government, the Department of Justice, the Department of Labor and Employment, the Department of Tourism, the Department of Transportation, as well as the Department of Information and Communications Technology, or DICT. The task force will convene a high-level meeting tomorrow, January 31, 2020, to discuss the first confirmed case and developments arising from these health events. The Bureau of Quarantine remains on high alert and is in constant coordination with authorities from all ports of entry for stricter border surveillance. DOH assures that its health facilities are equipped and prepared to receive and care for PUIs, as well as confirmed 2019 NCOV cases. DOH has recorded a total of 29 PUIs, 18 in Metro Manila, 4 in Central Visayas, 3 in Western Visayas, 1 in Mimaropa, 1 in Eastern Visayas, and 1 in Northern Mindanao, and 1 in Davao. 23 PUIs are currently admitted, and 5 have been discharged, but are still under strict monitoring. DOH also reported 1 PUI mortality yesterday. We did that. Finally, I urge the public to stay calm and remain vigilant at all times. Let us continue to practice good personal hygiene and indeed adopt healthy lifestyles. Thank you.
Okay, we have at least one question each. Tina.
Yes, good you asked. I would like to invite in Director Chito Avelino of the Bureau of the Epidemiology Bureau. Chito, please.
Thank you, sir. With the information that we gathered this morning from the result of the laboratory, we have coordinated this time with the Bureau of Quarantine and the CHT of Region 7. What we did with DOQ is that with the, we requested for the flight details, kung ano yung mga flight carriers na sinakyan ng pasyente at saan pumunta, tinitignan natin yun. That is after we have gathered the information from the patient as to what were the flights they took. Aside from that, we also coordinated with the CHD Region 7, and we are looking at the places where they've been to in Cebu and in Dumaguete. Once we have seen or we have the list of these places, then we do the contact tracing. For the plane, we do the rules of 4. That means we need to identify passengers, 4 passengers front, 4 passengers at the back, and 4 passengers on both sides. Then we contact these passengers and advise them accordingly. But for the community, we are looking at the establishment where they stayed and advise the establishment owner to identify the employees that had been in contact with the patient, and from there do the mandatory quarantine to observe them if ever they will manifest any signs and symptoms of respiratory infection.
But
I'm surprised because we don't have that information either. We don't know how they arrived at that estimate. As you know, estimates are only estimates. We don't know what basis they used for the arriving at the estimate. We don't certainly have that information. As the secretaries mentioned, there are many patients that are considered PUIs, in fact 29, but not only one of those have been confirmed. Many others have been excluded because the tests have come negative. So I have no information as to how this institute arrived at this estimate. So we are reiterating the most recent numbers issued by our headquarters last evening was 6,065 cases reported to WHO with 132 deaths. More recently this morning, the Chinese have reported further increases in numbers and deaths, which have not yet, I believe, been reported to WHO. But among all of these cases, as you see, there's only 132 deaths that have been reported. If you're looking at a mortality rate, you're talking of less than 3% deaths. This is much lower than previous coronavirus infections, just so that we look at it from a realistic perspective. So you're correct. The DG has asked for a reconvening of the emergency committee of the international health regulations that will be relooking at the novel coronavirus situation. Part of this is because of the increased number of cases that are being reported in China, but also increasingly beyond China. I believe we have now confirmed cases from 15 other countries. So this changes the situation from the time the committee met on the last occasion on the 23rd, and they will be looking at whether this current situation and the evidence and knowledge that has been gained since the last meeting now constitutes enough evidence to classify this event as a public health emergency of international concern. Let me explain that. What would that mean? If WHO then decides to classify this as an international emergency, a public health emergency of international concern, it would then mean that we would work with member states to actively stop the transmission of this virus, and that may include restrictions that are agreed with member states to facilitate that process. What those restrictions are, we cannot tell, and that will be based on the risk assessment and the conclusions that the committee reaches this evening. But the aim of the declaration is to prevent the further spread of this disease and to control it as early as possible.